Opinion: AI's paradoxical gift to primary care perspectives. Second opinions: advanced technology enables doctors to return to the fundamentals of care. September 27th, 2025, 3-minute read. Primary care is the foundation of a well-functioning healthcare system. It's where relationships are built, it's where we prevent disease, and it's where complex health needs are managed with skill and compassion. But the systemic support for primary care in the U.S. is under strain, and administrative tasks too often crowd out the most important work, connecting with patients. That's exactly why primary care deserves more than the bare minimum it has received over many years. It deserves the resources and tools that allow it to thrive. Enter artificial intelligence, AI. Unlike previous technology rollouts, which often added to clinician workload, AI has the potential to reverse that trend by taking on some of the administrative and cognitive loads that weigh down primary care teams. We're already seeing signs of this shift. In a recent survey, https://damn.aafp.documents practice management AI roadmap.pdf of more than 1,200 primary care physicians and clinicians conducted by the American Academy of Family Physicians and Rock Health, over a third reported using AI tools in their practice setting. Some use AI to generate first drafts of clinical notes, freeing them from hours of documentation. Others rely on it to sift through reams of patient data, including labs, imaging, and prior visits, to surface the most relevant information quickly. Additionally, a growing number are experimenting with AI-powered chatbots to streamline routine patient communication, from medication refills to appointment reminders. Each of these cases chips away at the mountain of administrative work that keeps clinicians from doing what matters most, which is listening to and caring for their patients. The potential for time savings is profound. Imagine shaving 10 minutes off time spent note-taking or filling out prior authorization forms. That time, multiplied across a day's schedule, adds up to more meaningful conversations, more preventive care, and more chances to catch subtle health changes before they escalate in patients. But the path is not without pain points. Physicians worry about the accuracy of AI-generated summaries, especially when patient safety is on the line. Many tools are still clunky or are not well integrated into electronic health records, or they create new workflows instead of simplifying old ones. And the risks, such as privacy breaches, bias, or unclear liability if something goes wrong, are real. These concerns are magnified in primary care because of its unique role. Unlike specialties that focus on narrow conditions or discrete episodes of care, primary care is longitudinal, holistic, and relationship-driven. It's not just about getting the diagnosis right. It's about knowing the patient's story, their family, their health goals, and their barriers to care. AI in primary care must be designed to augment that relational work, not flatten it into data points. Where an AI tool in radiology might be judged by how accurately it reads an image, in primary care the standard is different. Does it help a physician build trust, sustain continuity, and deliver whole-person care? That's why optimism must be paired with caution. We've learned from past technology rollouts that when tools are implemented without clinician input, they can cause more harm than good, deepening inequities, fragmenting care, and accelerating burnout. The lesson is clear. If AI is to succeed in primary care, it must be designed and deployed in partnership with the clinicians who understand its promise and its pitfalls. If we get this right, AI could help stabilize the workforce, reduce administrative overload, and make primary care more accessible to the millions of Americans who need it. Most importantly, it could give physicians back the one resource they've been losing for decades: time with their patients. And in primary care, time is everything. It's the difference between catching a condition early and missing it entirely, between a rushed checklist and a conversation that uncovers what matters most to a patient, and between a clinician who's burned out and one who's fully present. While AI is a big technological step forward, the benefit it provides to primary care is paradoxically all about the basics. Primary care has always been and must continue to be the most human part of healthcare. With AI as a thoughtfully implemented partner, we can keep it that way while making it stronger than ever. The technology is here. The need is urgent. The next move is ours. R. Sean Martin, MS, https://www.aafp.org/leadership/AAFP-EMT. Is the CEO and Executive Vice President of the American Academy of Family Physicians.